To get an idea of just how large San Diego County is, look at a map of the United States. Pick the state of Connecticut. We're about the same size, almost the same population. In fact, 21 states have smaller populations than San Diego County. We have dozens of hospitals, clinics, medical offices, schools, first responders, military personnel, and government agencies. Getting all those people to do anything in unison is tough. So, how does a local government come up with a plan for building better health and living safely? Well, our Board of Supervisors did 3 years ago. It's called Live Well San Diego. In uncertain times with prisoner realignment, the Affordable Care Act, state budget issues, Live Well has served us well.
We've had an absolute rallying around of our partners. They love it. The vision is simple. It's something that they can understand. And when they can understand it, then it helps the whole community to get involved and move it forward. And I think that's one of the reasons why it is becoming so prevalent.
See, Live Well San Diego is a real paradigm shift in the way we think of public health and personal safety. Never before has a county government brought so many different stakeholders together to start a 10-year plan for improving the health and safety of an entire region. The first year, the focus was on building better health, creating a connected health delivery system, pushing for policy changes that make it possible, and looking at ourselves, improving our own culture from within. Now we wrap up year 2. Living safely was the focus. It's about empowering people to take charge of their own health and safety. And Harborside Park here in Chula Vista is a really good example of this. You see, a while back this place was kind of a mess. Lots of gangs, lots of crime, not a very family-friendly environment. So the community got together with the county, the city of Chula Vista, and some of the nearby businesses around here, and they took back the park. Now it thrives. See, if you don't feel safe at a place like this, you're not going to get out, you're not going to exercise, you're not going to form that walking club that meets here a couple of days a week. You're not going to feel like you're a part of the community. And that lack of feeling safe can have a huge ripple effect on health.
Working together and making sure that we could provide a safe place for the community, the families, the kids, the employees was something that we wanted to do. When you have a safe park, you have the ability to have more people enjoy the activities in the park, which ultimately recreation provides to their health and well-being.
And well-being goes beyond just the physical. You see that in the senior volunteer patrols throughout the region.
The whole pay back is the good feeling that you feel. When you see a person that's a Yana, you are not alone person that we visit, and their face just lights up with a smile to see you and know that someone cares and is checking on them, so that if something happens to them, they know someone's going to be knocking on that door or making that phone call and saying, you know, are you okay?
Like what we do with the Senior Volunteer Patrol, where they're out there working with the community. What we try to do in community-oriented policing is bring everybody into the picture. What we know in law enforcement is that criminals, bad guys, like nothing more than a neighborhood full of strangers. That's the kind of community they can prey on and they can thrive in. The more that citizens, the community know each other, watch out for each other, that's a safer community. And then when you take that environment and combine it with the expertise and the professionals in law enforcement, it's a tough team to beat.
The county's Vital Aging Summit shows seniors and others how to eat healthy and stay active. Part of living safely is helping communities be resilient to disasters and emergencies. Things like drills showing school personnel how law enforcement responds in the unlikely event of a school shooting. We launched a child care disaster plan, focusing on ways for daycare providers, group home operators, and others to keep kids safe during disasters, and new plans for the county and city of San Diego to work together and operate joint recovery centers after a disaster. Then there's realignment, the state shifting responsibility for thousands of prisoners to counties to save money and ease prison overcrowding. Suddenly, the county is pressed into action, getting offenders pointed in the right direction so they don't wind up back in custody.
Our office has been a statewide leader in re-entry, in turning people's lives around and stopping the revolving door of prison. And that becomes really important right now, where we have prisoner realignment that is putting more people into the streets in our local jails. So getting them clean, sober, and productive is our main focus right now, so that people in their neighborhoods can feel safer to do the things they want to do in their own communities.
Live Well San Diego is all about forming partnerships in the community on the streets where health and safety happen. The Department of Public Works helps communities design safer walkways, making it easier for kids to walk to school safely and adults to get outside and get moving.
The county has been a huge help and supporter in this issue. They're part of our Safe Routes to School Coalition, which is made up of multiple organizations, but they've come out and they've surveyed the roads for us. They've restriped in areas that we needed, and they've also moved a crosswalk for us. What we found is that our number of walkers has actually increased since we started this.
County libraries have a variety of healthy eating classes. Our Project Shine works with the growing Iraqi refugee community in the East County, breaking down cultural barriers, learning when to call 911, the do's and don'ts of healthcare, and helping them learn English to be more self-sufficient. Another partnership, Northgate Market, was named the first Live Well San Diego business. The firm received high marks for promoting healthy food choices and hosting wellness events so that customers and its employees can lead healthier lives. And not just grocery stores, we now have official Live Well school districts, city governments, even chambers of commerce.
As a Chamber of Commerce, it's critical for us to show ways and encourage businesses to take every step possible to bring their costs down. They can invest more in their employees. So we've taken a lot of your Live Well initiative and a lot of your ideas and the tools, and we've implemented them into the website, which we've then pushed out to all of our members.
As mentioned, part of Live Well is looking into the mirror, improving the culture from within. You see, we as county employees can't put out a health and safety message if we don't make changes in our own lives. We stepped up to donate blood. The annual County Employee Blood Drive is one of the largest in San Diego County. Hundreds of pints were donated. We also held blood pressure screenings at county buildings on Valentine's Day. Being good to your heart on that special day, we encouraged employees to add to the National Bone Marrow Registry Drive. The large database could help fellow county employees and all other county residents and may provide cures for potentially life-threatening diseases.
Today, I'm still fighting cancer, but my odds of beating are much better because of the bone marrow transplant. Your blood or marrow could save the life of a loved one, your neighbor, or your friend.
Some of my best walks come every morning with my buddy Riley.
We encourage healthy living and a safe work environment by being good examples. Starting at the top, each quarter a county executive is on camera encouraging employees walking, healthy eating, exercise, and maintaining a healthy weight.
When I reached about 287 pounds, I said this is enough. So I started cycling, just going a couple of miles a day, and now I'm over probably 100 miles a week. And you know, my joints feel good. I'm not I don't have the blood pressure issues I had. I'm totally off medication, and it is just, it's just inspiring.
For county government, one of our main roles is to make sure that we're looking at our day-to-day operations. And by seeing how it fits into safe living, healthy living, it enables us to make sure that our community is thriving. And so all of our employees have bought into that vision. They understand it, and they can see what their role is and how to make the most impact on our community.
Building better health, living safely, the first two pillars of Live Well San Diego. They're intertwined. One doesn't exist without the other. Live Well itself is threaded throughout the entire organization across all county departments to make sure all of us in San Diego County thrive.